Hi, this is Piyush Bhargava, and I have a few interesting cases to share with you. Our first case involves a patient with history of pancreatic cancer who has had Whipple procedure and presented with rising tumor marker, which is CA19-9, and the whole body MIP image from the FDG PET CT scan is shown here on the left. We see this focus of hypermetabolism in the mid-abdomen. This corresponds to the site of post-surgical changes seen in the midline abdomen. And on the contrast-enhanced CT, there is infiltrative, ill-defined soft tissue seen at the site of pancreatic jejunostomy, seen here on the coronal image. This is characteristic of recurrent pancreatic cancer as seen on a contrast-enhanced CT and also seen as focal hypermetabolism on FDG PET. This is a good article on the topic where the authors conclude that in patients suspected of pancreatic cancer, recurrence FDG PET reliably detects local recurrence. Our next case is a patient with history of lung cancer who had a whole body bone scan. Here we are looking at anterior and posterior whole body images in a higher intensity and then in a lower intensity, showing intense uptake involving the left hemipelvis, the sacrum, and a vertebral body. And so is this bone metastasis or could this be something else? So here is this patient's whole body FDG PET CT scan, where on this rotating image we find intense uptake involving the right lung malignancy seen here and here on the fused PET CT image, but there is no uptake seen in the pelvic bones as we saw on the bone scan. Here is some images from their CT scan showing sclerosis, thick trabeculation, and also bone expansion involving the left side of the pelvis as seen here, and these findings are consistent with Paget's disease. Here is a good article on this topic. Here the authors conclude that Paget's disease of bone is not associated with abnormal FDG uptake in majority of patients. They also say that rarely marked uptake of FDG may be seen, and Paget's disease should be included as a possible cause of false positive scans in elderly patients who are being assessed for metastatic disease. This is our third patient, a young female who presented with a mass in the right breast. She underwent a mammogram and an ultrasound guided biopsy, and the biopsy showed lymphoma. And so she underwent a whole body FDG PET CT scan to stage the lymphoma. On this rotating image, we find that there is a focus of intense uptake seen in the right breast. This focus is seen here as a soft tissue density mass with a hyperdensity, which is a clip post biopsy, and there is focal hypermetabolism. Also on the rotating image, we find that there is heterogeneous increased uptake involving the bone marrow, and this finding is characteristic of diffuse lymphomatous bone marrow involvement. And there is one more finding here, which is lymphomatous involvement of the spleen. And so look at the spleen, it shows diffuse uptake which is more intense than the uptake in the liver. And so we see that finding right here where the spleen is slightly more active than the liver, and that's characteristic of splenic lymphomatous involvement seen here also on the fused PET CT image. This is a article on lymphomatous involvement of the breast. Here the authors say that rarely the breasts are affected due to lymphoma. Most of the times it's a B-cell lymphoma. Rarely it can be a T-cell lymphoma. And in those patients, there are skin and subcutaneous changes that frequently accompany the T-cell lymphoma. Thank you for watching.